Hello, my name is Dr. Sabrina Fabi, and I'm a board-certified dermatologist practicing in Southern California at Cosmetic Laser Dermatology. And today we have a 55-year-old patient who notices what a lot of my patients notice, which is that their lips are just shrinking a little bit with age, but they're scared of having their lip look done and inflated. So you can see with Pam, she used to have a bigger lip. Her lip is there. But they shrink with age, and so with her I don't want to give her duck lips or add more projection, but I want to hydrate these lines that you can kind of see that start to develop within the lip, or what we call vermilion, or the red of the lip itself. And so Volbella is an excellent product to do just that, and results last up to a year. So here we are, and I'm using a 25 gauge 1.5 inch cannula. It's this soft little tube, and I like to come in from one insertion point, which you're going to see me do today, and then essentially treat the entire lower half of the lip. I find that this technique allows me to evenly and softly distribute product to the entire half of the lip without pokes every single 1/2 inch, which is sometimes what you have to do when you use a needle. So I really prefer a cannula, and I'm going from one insertion point to treat the entire half of the lip, so that allows minimal bruising and minimal pokes, which equates to less pain for the patient. And immediately followed, and I'm using very little product. Hydrate the lip. I do 2 passes to really coat that surface of the lip. So here I am just sliding the cannula. You can see how painless it is. She's doing just fine. There's a little bit of lidocaine in the product. I come back, I do another coat, essentially just creating a little lip gloss, a natural lip gloss, so she doesn't have to apply any today. So here we are, just 3 minutes after injection, and you can see how pretty her lips look. They look like I've put essentially some lip gloss. So not a lot of volume, very natural. You can see my insertion points, or barely see my insertion points, because I used a cannula coming in from the corners so as to hide those insertion points so that no one will notice today when she goes about her day that anything has happened, and that minimizes any trauma, therefore swelling, that she may experience from the procedure. And so Pam, how was it for you?
It was great. Just a little bit of pressure and that was it.
You can see essentially the softening in those lines open up gently. You can see there's no evidence of any insertion point. Her lips look a little bit more glossy. I like to think of it as the natural lip glosser that you don't have to keep reapplying. And this is essentially it. She's not going to have much more swelling than this. And this is probably going to be the result she experiences from now on to as results continue to drop off over the next year. So that concludes our treatment with Volbella, which we are so excited to be offering here at Cosmetic Laser Dermatology, in which I'm very excited to be chosen as one of the national trainers for the procedure.